Good afternoon, folks. It's April 1st. It's a Thursday, and I am Robert Chappell, your executive editor at Madison365 with the daily update for today. Okay, guys, put your masks on. It's the COVID news is just not good today. The vaccine news is good. It's fine. The vaccination numbers are good. But I have significant concerns about the spread of the virus right now. Now, my significant concerns again are about the spread of the virus. I'm less concerned, slightly, about the severity of the virus that's spreading. Okay, we're at the point of this thing now where we can kind of start to separate those two things. We don't have to necessarily assume that that cases are going to be as severe as they were. Why is that? Because we've gotten most people over 65 vaccinated, and we've gotten over 1 million other people vaccinated, such that the likelihood is that I don't have all the data in front of me to bear this out, but the likelihood is that the average age of the positive cases is getting younger and therefore less vulnerable, and also that some of these folks who are testing positive are vaccinated and therefore they're just not going to get as severely ill, right? Okay, so that's the only mitigating factor, and that makes this news not so terrible. But here's the reality of the situation. The 517 new cases today out of 4,600 tests. That ratio, about 11%, is not as bad as it was earlier this week. But again, those are just the tests that are reported today. 517 new cases, not great. That's our third consecutive day over 500 new cases. That's not great. That puts our 7-day average of 468, which is actually down slightly. So that's okay. The two numbers that I really don't like are 2.9, the positive test rate. Remember 3.0, we need to keep it under 3.0. We spent all that time, all as many months getting it down. It was like 14% at one point. We've been working and keeping our masks on and ordering our groceries and not eating out, and doing everything right to get it down below 3%. We got it all the way down to 2%, and now we're back at 2.9. So we're on the edge of that 3.0 threshold again. And 3.0, there's nothing magical about that number, but that you ask a public health person and you ask an epidemiologist, what's the positive test rate that you're comfortable with, that says we have this under control? They're gonna say roughly 3.0. We're at 2.9. It was 2.8 yesterday. It was 2.7 the day before that. Not great. The other thing that's not great is 6,980. That's the number of active cases. Again, this is a rough measure of active cases. That being diagnosed in the last 30 days. So some people are still active after 30 days. Some people are inactive after 2 weeks, but 30 days is a good rough estimate. And that number has been going up for the past 4 days consecutively. So there are more and more known active cases. Also not great. But the worst news, in my mind, is the fact that we now have identified 139 cases of the UK variant. That's the B117, which is significantly more. It doesn't make you more sick. It's not more dangerous to the individual, but it is more contagious and therefore more dangerous to the community, right? We also have 8 cases of the South Africa variant identified and 2 cases of the Brazil variant. Now, those numbers feel small, but here's why I don't like those numbers. The only way to identify those variants is to sequence the genome, right? So they do this on a random selection of positive cases. They'll sequence the virus and determine which variant it is, if it's the sort of the regular one or one of these more virulent variants. And to date, they have done that sequencing on 9,124 cases. So you've got 1.5% of all those cases are the variant. But that's going back a month. If you just look at the past week, they're reporting the sequencing of 661 cases, of which 77 are a variant of one kind or another. 68 of them are the UK variant. 7 of them are South Africa variant, and 2 are Brazil variant. So that means of those cases that have been sequenced in just the past week, 11% are variants. 10% are just the UK variant. Therefore, if we're being pessimistic, realistic, it's reasonable to think, it's reasonable to surmise that of the 517 new cases today? Yeah, 517 new cases today. It's reasonable to surmise that 50 of those are UK variant. It's reasonable to surmise that 56 of the cases reported yesterday are UK variant. It's reasonable to surmise that 59 cases that were reported on Tuesday are UK variant. That's over 150 new cases of UK variant confirmed in just the past 3 days. Now, they haven't been, again, that's based on a statistical guess. If 10% of the random sample is UK variant, then it's reasonable to surmise that 10% of all the cases are probably UK variant. Not a for sure thing. We can't say for sure that there are today 51 cases of UK variant were confirmed. We can't say that. We can say, though, that 10% of the cases that were sequenced in the past week were UK variant. And that's not good news. Because that variant is more contagious. If we just did everything the same, the cases would go up because there's a more contagious variant. But the fact is, we're not doing everything the same. In the past 2 months, we have eased restrictions. We have repealed a mask mandate just in the past day. Just yesterday, we repealed a mask mandate. We're going outside more. We're gathering in groups more. We have less restrictions on indoor dining in those municipalities that had restrictions in the first place. What that means is with those variants, if we changed nothing, the numbers would go up. And if we ease restrictions, numbers are going to go up even faster. So I have, I'll say it again. I'm not the doomsday journalist guy. I'm not going to give you bad news for clicks, right? I'm not going to exaggerate the bad news to get more viewers. So when I tell you I'm concerned, you can believe me. I am significantly concerned about these variants. I was concerned about the uptick in the positive test rate. I was concerned about the third day in a row of 500 new cases. And then I saw the variants, and I was really concerned. I am really concerned about those variants. So what does that mean? Get vaccinated when you can. The vaccine, by all appearances, works fine on the variants. So the first thing we can all do together is to get everybody vaccinated as fast as we can. Get your shot. This is not the time to be like, I'll wait my turn. Everyone is eligible on Monday. Get your shot. Find your appointment. The other thing is until we get everybody vaccinated, keep your mask on, keep your distancing, do all of that stuff. Do everything that's gotten us this far. Let's not drop the ball now. The worst thing we could be doing is seeing a surge while we're trying to get everybody vaccinated. Like we need to keep it low so that we need our health authorities focused on vaccination. Right? We need our county health departments, we need the Department of Health Services, we need the universities, we need school districts, we need everybody focused on vaccinations. If we're out here acting foolish and causing more infections to be sent to the hospital and we're more spread and we're having to, and then the county health department has to institute a new order restricting gathering sizes again. Like they're taking their eye off the ball of the vaccinations. Let's keep the thing low so that they can focus on vaccinations. Okay. I don't mean to lecture you. Put your mask on. Now, on the vaccination front, there is decent news today. 76,000 more doses reported in the past 24 hours. That's a lot. That's great. There is more Johnson & Johnson on the way. There's some that I haven't confirmed fully yet. I mentioned this yesterday, but I haven't confirmed the details yet. But I know of at least a couple of efforts that will make Johnson & Johnson shots available. Well, in fact, one of them there's one effort I'm going to tell you about after the break here in Madison, that there's a specific effort to get Johnson & Johnson shots to Black men. So, that the more of the single shot doses we can get going, the better that is. But if don't wait for that shot. If you have a chance to get a Moderna, don't be like, I'm waiting for Johnson & Johnson. Don't do that. Take the Moderna, wait the 3 weeks, get the second Moderna. You know what I mean? Get done, get out of the way so the state can move on to the next population. And we'll talk more about that too. There's more efforts. The efforts to get vaccine to those marginalized and underserved communities was announced today, and I'm happy to say Madison365 is going to be a member of that team. So I'll tell you more about that after the break as well. That's another piece of decent news. We are now 18.5% vaccinated, fully vaccinated, which is terrific. 1,076,000 people vaccinated fully. So that's great. And I think that's all the COVID news. Again, Robin, that's a good question. The numbers I'm giving you right now are statewide. Dane County numbers are significantly less alarming. I shouldn't say that. The case count in Dane County is going up significantly, like kind of a lot. Although it's going up by like the weekly cases have gone up like 20%, but 2 weeks ago the cases were really, really low. So it doesn't take much to constitute a 20% increase, right? The positive test rate in Dane County, that's statewide is 2.9%. In Dane County, it's still below 1.0. So Dane County, the spread numbers are much better than the state as a whole. But if you're in Dane County, still don't take your eye off the ball. Keep it that low, right? Yes, and this is absolutely true. We should be worried. Like France is doing another lockdown because of the variants. Again, it's going to be very easy for us to drop the ball and let these variants get out of control. Let's not do it. Okay. I said this a long time ago. We're not going to get any help from the government on this. We got to do it ourselves. We got to keep our distance. We got to keep our masks on. Numbers are okay right now, but they're going to get out of control if we're not careful. That's my main thing. I don't want to panic. It's just we're not surging like we were in November, but we're going to if we're not careful. So be careful. All right. Enough lecturing. I'm going to take a short pause, and I have all sorts of very good news regarding your favorite community news outlet. So stay with us, and we will be right back. So you might have heard at some point about the Rebalanced Life Wellness Association, and Aaron Perry, who started that, and the Men's Health and Education Center, which is inside JP's Hair Design barbershop on the west side of Madison. This is a spot where dedicated to Black men's health, recognizing that Black men have, disproportionately bad health outcomes, generally speaking, due to lots of factors. But there's just structural racism built into the healthcare system, and there's sometimes a reluctance among men generally, but black men as well in particular, to go to the doctor or thinking about their health, or being concerned about their health. So Aaron Perry has put together this clinic at the barbershop. So when you go to get your haircut, you can also get your blood pressure checked, or your insulin, your glucose, and get counseling on diabetes and kidney health and heart health and cholesterol and all that stuff. So Aaron is now leveraging this. Is leveraging this into a vaccine program. So what he's done is he's partnered with Fitchburg Community Pharmacy to provide Pfizer vaccines for anybody 16 and older, and Johnson & Johnson vaccines for anybody 18 and older. So if you're over 18, you can have your pick. And that's going to be on Tuesday, April 6th from noon to 3 at JP Hair Design. He's also partnering with other barbershops around the Madison area, and more of those clinics will be announced in the future. So that's a great way, especially, like I said, everybody's eligible next week. So if you're, especially if you're a Black man, you want to go to the barbershop, get your shot, do it, get it done, tell your friends. LJ has a great question. There's a great comment. I'm going to come back to that after we talk about a couple other news items. But also in the news today, this is where I spent my morning downtown. As you might remember, I told you about Urban Land Interests, which is a developer here in town, donated this space to the Boys and Girls Club. And we had this ribbon cutting today and a little tour and a little press conference. And Urban Land Interest owns this building. It's on the corner of East Washington and Pinckney Street. It's prime location on the Capitol Square. And they're going to be using it for nonprofits, basically. And sort of training space, co-working space, events, fundraising events, pop-up events. They've got the Quiznos next door. Also, the former Quiznos. You can have a nonprofit, personal color-owned businesses, pop-up shops over there. And this is going to be our office. That what you're seeing right now is going to be our primary location. We actually had to give up our office because of the pandemic a year ago. So we've been working without an office, without a newsroom for a year. And so this wonderful place is going to be our office. It's also going to be the headquarters of the Black Men's Coalition in Dane County, and Feeding the Youth, which is a relatively new nonprofit founded by Jasmine Brown. They have fed 2,000 families in just their first year. So this is, like I said, prime downtown real estate. It's important for us as a community newsroom to be in the community, right? And we've done a lot of good work this year remotely without being together as a team. And now that, assuming we get these variants under control and once we all get vaccinated, we'll be able to once again return to being present and visible in the community. So, if there's an open house tomorrow, Friday from 10 to 5. So stop by anytime. And it'll be at least a week or two before we get vaccinated enough and have kids back in school enough to have to be really present there all the time. But come summer, you're walking down the square and you want to stop by and see us, please do. You got a news tip, stop by. The other thing too is, just as a reporter, I got to tell you, I'm so looking forward to being not only across from the Capitol, where we can pop over and bother the legislators, but also, around the corner from the courthouse. You got to go get court documents every now and again, and just instead of just being near all that government stuff and to be able to easily, get to city council meetings, that kind of thing. The other thing I'll mention is Allison has a great question. The other thing that's happening at this space is volunteer events. And in fact, today, the day they have the press conference open, if they had a volunteer event where in the former Quiznos next door, they put they were had probably about 10 volunteers putting together Easter baskets. Like Metcalf's and Clausen's Bakery donated a bunch of stuff to fill 400 Easter baskets for kids who may not be able to get one otherwise. So that's the kind of event that's going to happen there. So definitely, if you are a volunteering kind of person, stop by, talk to the Boys and Girls Club, talk to Feeding the Youth, and see what they need. Always necessary, always needed to volunteer. So that was fun, and we appreciate Boys and Girls Club. And I'll also mention, just as a disclosure, like we're gonna, as a nonprofit newsroom, ethically speaking, we have to disclose all of our donors. So that's what I'm doing. I'm telling you, the Boys and Girls Club is donating the space to us because they got it donated to them. So that has some value. So they'll be listed as a donor on our website, just like other funders. But also that they understand, and we understand that it's not going to affect our coverage of them. They don't get extra good coverage for being donors, and they don't expect it. So, don't think that we're going to be our coverage of Boys and Girls Club is going to be impacted by this. It's just not. But that's for the sake of transparency, that Boys and Girls Club now is a donor to us, and we're very appreciative of that. But you have a right to know that where our funding comes from. The other thing this does, we actually, when we let go of that, we actually, when you think of a newsroom, you think of like all the King's men and like all the people bustle and the buzz of the newsroom. And when our old newsroom was basically just a room in this great co-working space called 100 State. And it was just this really small room with 2 desks or 3 desks in it. And people would come by and be like, this is it. This is where you work, that we had to do all this big stuff. And we actually had to give that up at the beginning of the pandemic because, first of all, we knew we weren't going to use it. And they moved. 100 State moved, and it was going to be more expensive. So we just said, we're not going to have an office anymore. And we had already kind of decided at this point, as we're coming out of the pandemic soon, we hope, we had decided we're not going to get a new office because we see the value. We need to spend all of our resources on journalism, right? On bringing you the news, on keeping our ears to the ground, on being out in the community, on writing the stories, telling the stories, doing the podcasts, doing this video. We need to dedicate all our resources to that and keep our overhead at almost zero. So we already decided kind of that if even once the pandemic's over, even once we can get back, we were planning on having like our staff meetings at the library, that kind of thing. So this allows us to have a space, have a visibility, have a presence, but also continue to put all of our resources toward the journalism, toward the work, right? And we are going to pay utilities. We're going to share the utility bill. We'll sign an agreement and everything. So it's going to be all above board, but that's what that allows us to do is really, really valuable. So yes, it is very exciting, and I appreciate all your enthusiasm. One other piece of news about your favorite community news outlet. I mentioned that the state had given grants, had announced $6.2 million in grants for vaccines for community organizations, local health departments, school districts, and other organizations to help get vaccines to communities of color specifically. Because here's the thing. We talk about this a lot. The vaccines are cruising. Vaccines are going fast. But of those who are fully vaccinated, 78% of the state population is white. 85% of the population who's been vaccinated is white. 6% of this population is black. 2.5% of the population that's been vaccinated is Black. 7% of the population is Latino. 2.4% of the population that's been vaccinated is Latino. Those are unacceptable. So when we're talking about eligibility based on age, eligibility based on occupation, those are going to be disproportionately white. People who have color, marginalized communities, English as people who speak English as their second language, or maybe don't speak English very much at all. People who have hesitancies for whatever reason, which that actually is less of a deal than it was made out to be. But there's a lot of barriers for a lot of people. And 100 organizations now have state money to do some work to try to overcome those barriers. And a lot of it is literally like driving people to the clinic, leveraging community partnerships to set up pop-up clinics in specific neighborhoods to get culturally competent medical staff into neighborhoods. A lot of it is on the ground, but then a lot of it, some of it also is information, because that's one of the barriers. Is I don't know about this. I don't know how to get an appointment. I kind of don't trust it. I'm a little worried about it, and that's what we're going to help do. We've got some state money we're going to do a PSA video. We're going to do a series of articles. You're going to see more like experts, like vaccine experts on this show. And some of the money, we're not paying them to be on the show. Some of that money will go to staff support to book those guests, and then to amplify and like spend some money to promote that video on Facebook and stuff. So we're very proud and happy to be part of the team that's going to get that last mile, that last bit done. Like I keep saying, the low hanging fruit for vaccines is guys like me who can I get a call, come get your vaccine. I can leave work. I can go on a moment's notice. A lot of people can't do that. So it's going to take a lot of intentional effort to get that last push, to get all those people who can't just readily drop everything and go get a shot. And I'm very proud to be part of the team that's going to help that happen. Even if our portion of it is information and education and bringing together voices. And we're gonna host a virtual town hall on vaccines, where you can, if you have questions or worries about vaccine, you can ask the experts on Facebook Live. We don't have a date for that yet, but that's one of the things that the state grant is going to pay for to do. So we just found out about that yesterday. We don't have the money in the bank yet, but it's exciting, and we're happy to be part of that, part of the team. One more thing in national news before I get back to that question that I didn't want to miss. I mentioned this yesterday, that some companies that are based in Georgia are not very happy with the voter suppression laws that have been passed. And the CEO of Coca-Cola has spoken out. We've got the story on the website right now. Has said that this is unacceptable and opposed to American values, basically. That all the laws, the voting restrictions that have been put in place in Georgia. I'm sure you've heard about those. It might be a little bit too little, too late. Like, where were you when all these laws were being passed and signed? Like, it's kind of too late now. But these Georgia-based companies are now calling on Congress to pass HR 1, which would basically overwrite all of these local restrictions and protect voting rights at the federal level. So that's an interesting and ongoing conversation. Now, I want to go back to the COVID conversation, because this is a great question. And it's prescient because I have some additional information about this. The comment is, they have to assume that Dane County % positive is being skewed by the twice per week testing of UW-Madison. I would not use the word skewed, but yes, you are absolutely right. That the reason it's so low is because there's a lot of testing on campus. The trends are still valid, but not apples to apples in terms of positive % versus any county without a similarly sized testing program. Here's the thing. You're not wrong. You're 100% right. But I would look at it slightly differently. And not to say that you're looking at the wrong way, but one of the reasons that you want a low positive test rate is that it indicates that you're doing a lot of testing, right? A lot of testing is a positive indicator, even if most of the testing is negative, even if it is that twice a week preventative testing, right? So it feels a little backwards to say, like, if your positive test rate is super low, that means you're doing a lot of testing, and that is good. A lot of testing is good. It's not that it's not that it doesn't make the positive test rate falsely low. It's low because there's a lot of testing, which is good. It's not skewed. I wouldn't say skewed. I would say it pushes that number down, which is good. We want that number to be low. It's not artificial because it's real numbers, but you're right that one of the reasons it's low in Dane County is he's doing a lot of testing. And the fact is that the statewide number is higher partially because most other counties don't have that level of testing. If everywhere in the state had that level of testing, our statewide number would be lower and we'd all be happier. And that wouldn't be false. That would just mean we'd be catching the same number of cases, probably. Maybe slightly more cases. But we'd be isolating them quicker, right? So you are right that it is affected by that. It is also true that UW testing will be going down soon as campus shifts to focus on vaccine. As students get vaccinated, the students on campus, I don't know if you're aware of this, there's an app on their phones that they have to hold up, and if it's green, you can go into the buildings. If it's red, you can't. And if the green, so far up at this point, the green on the app means you've been tested negative recently. Now, you can also get that green by getting vaccinated, which means students are getting vaccinated, which means that all those vaccinated students will get the green badge on their app and won't have to get tested anymore. So there will be less testing on campus, which might mean that the positive test rate in Dane County alone goes up a little bit, or a lot, which would not be the best outcome. But I hope that makes a little bit of sense, because it's a terrific question and it's an astute observation. And I appreciate you chiming in with that. And that's just my take on it. Again, not to say that you're wrong to think about it that way. Okay, that is the news for today. To recap, bad news on the COVID variants and the COVID spread numbers, but good news for Madison365, for your favorite community news outlet. And good news for the effort to get vaccines to marginalized populations. It is, I have to say, it's unusual for a state grant program to get done this fast. We put in an application, I think it was March 19th. Like, that wasn't very long ago. It was like less than 2 weeks ago that we submitted the application, and we found out late yesterday that we got funded, or that we will get funded. So that's remarkable that the state is moving that fast. I should say of the 6.2 million, 3.1 million is federal fund, and the other is state. And if you want to see all the organizations, the amounts of the grants range from 10,000 to 100,000. Ours is kind of right in the middle, 49,000. But it's an interesting list. If you go to Madison365.org, there's the story is there, and there's a link to the full list of organizations. So I would urge you to take a look at that, just because you can see then what organizations in your area are doing this work, and maybe you could find a way to volunteer and chip in. All right, that's all I have for you today. Once again, thank you so much for being with us. Sounds like it's going to be a nice evening and a really beautiful weekend. So we'll be back tomorrow at 4 p.m. We'll see you then. Until then, take care.
This is 365 Media.